All right, welcome everybody to the Low Carb Leader Podcast. This is the video version, and today we have a great guest on, Dr. Nadia Pataguana. Dr. Nadia graduated from the Canadian College of Naturopathic Medicine in 2004. She has a degree with honors in biology from McMaster University. With a strong science-based approach, her four-year program includes traditional Chinese medicine, acupuncture, nutrition, counseling, and all other medical sciences, which I think is pretty cool. I want to talk about that a little bit. She currently is licensed in Ontario, Canada, and works with Dr. Jason Fung. And she was born in Mozambique, but raised in Canada, where she completed her studies. And then her life took her back home to work for a little while. So welcome to the show.
Thank you, Dan. This is great. Great to be here.
Yeah, great to have you. So that was a quick...
I know, a mouthful for you. Sorry about that.
Yeah. So kind of take us through a very interesting background and how you ended up where you are.
Yeah, it is. It's actually very interesting professionally, because I think it was because of all of these personal sort of fun detours that my life took that got me to working with Dr. Fung and Megan here in Toronto. So I was born in Mozambique. So Mozambique is a country right on the border with South Africa. It's a former Portuguese colony, so I have a mixed background. I was raised here in Canada, where I went to school. So I went to McMaster first and did biology, and then I went to the naturopathic college instead of going to regular medical school. I had some issues with IBS and a whole bunch of issues, and I felt like if I could heal myself through naturopathic medicine, then I was going to use that to help heal people. So initially I wanted to go to medical school, but then I decided to go to naturopathic college instead. As many people that I encountered at school, they kind of went through naturopathic medicine because of their own health struggles. And so that's what happened with me as well. Once I graduated, though, I didn't wait to practice in Toronto. I just got on a plane and went back to Mozambique. It was kind of a childhood dream of mine to live in Mozambique. I thought I was going to work. Sorry about the raspiness. I've got a bit of an asthma thing going on. Sorry about that, guys. I thought I was going to work for the government at the time and sort of work in that field with nutrition and all that going on in Mozambique. If you don't know anything about Mozambique, it is still a developing country going through their own struggles. But anyway, long story short, I wasn't able to do that. And so I had to open up a clinical practice, which was a bit of a detour for me. That wasn't what I initially wanted to do. And so I didn't have much to offer, to be honest. Being in Mozambique, there were no tools. There was no supplements. There was really, we would have to go to South Africa to get stuff. So the only thing I could offer people was nutritional advice. So it was kind of a funny thing, because there was a lot of interest in that. Funny enough, you would think Mozambique people don't want to lose weight, but they do a lot. And that was my main thing. People only ever wanted to come to me. I thought I was going to heal everybody of all these funny things, and they only wanted to talk to me about weight loss and other things, right? Like diabetes and all of that. But anyway, so I had to get really good at coming up with diets. So I had all of these diets that we tried out with people and figured out, okay, these work better, those don't. I didn't have a lot of training in that, as most doctors don't have a lot of training in diet, and naturopaths don't either, to be honest. And so it was 10 years of very fun sort of experimental work, because I had a lot of people, I had a lot of guinea pigs, and they were very forgiving. And so the fun thing is that throughout those 10 years, I realized a lot of things. And then I ran into my own health issues again. This time it was with fertility. So at about the age of 30, so I guess I'd been in Mozambique for about 4 years then, my husband and I had been struggling with fertility. And so long story short, we figured out that I had metabolic syndrome and I had insulin resistance. I wasn't overweight, but I had all these other fun things that come with insulin resistance. And so I found it interesting that a lot of my patients got pregnant without trying to, or they had had a lot of fertility issues in the past. But when they came to search for my help for weight loss, they ended up getting pregnant in the meantime in a very short period of time, usually within 2 to 3 months. And that wasn't that's not why they came to me. And so we started to figure out, okay, there's a link here, of course, big link. And so when I sort of developed my own metabolic syndrome, and I figured out with my doctor that I had PCOS, which is related to insulin resistance as well, and I had the infertility, I knew that my patients had gotten pregnant from following some of these diets. So I decided to put myself on the strictest of them all the plans that I had. Even though I wasn't overweight, I had gained a significant amount of weight in a short period of time, and it was all around the midsection. So I knew enough at that point to think, okay, this is what I need to do. And so when I did that, I got pregnant in a month, and I had done fertility treatments for a year, or 6 months, I guess 6 months of no fertility treatments and then 6 months of fertility. Anyway, long story short, 2 years later, I want to get pregnant again, or at least my doctor told me that I should try to get pregnant again because my condition had actually gotten worse. And that time around, I had a doctor friend who told me to take metformin, which was it's a diabetic drug, to help with my insulin resistance, because again, the second time the fertility treatments didn't work, and I didn't really go on any diet. I was, at this point, I was overweight, and I had a whole bunch of issues going on, serious metabolic syndrome at this point, medicated blood hypertension, lots of stuff going on. I had postpartum depression, and I didn't go on any diet. And so when the fertility treatments didn't work, she said to me, well, remember you're insulin resistant, so take metformin and do work on the diet, and let's see what happens. And then again, I got pregnant in a month. So it was very interesting. So of course that took me on a much more serious journey. Once I had my second child, I realized, okay, I have enough information here to heal myself. I need to take this more seriously. And I think that at this point, I knew what was going on with my patients and why people were getting pregnant. It wasn't just because they were losing some weight. It wasn't just any diet. It was a very specific low-carb diet. And the weight loss seems to help as well with PCOS and fertility, but it wasn't just that. It was the insulin resistance and how to try to reverse that. So that's what happened with me. And then my focus changed completely. So when I came back to Canada, I met Dr. Fung at a conference, and he introduced me to Megan, and then I started working with them. And although I see mostly people with metabolic syndrome alongside them that are mostly people with diabetes and obesity, they know that my focus is PCOS and helping people with fertility. So luckily, over the last little while, I've been able to work a little bit more on that, but I still do see other people as well.
Oh, okay. So the percentage of people the women are overweight compared to, because you were talking about weight is an issue sometimes, weight is not an issue sometimes. Is overweight, obesity a big reason for infertility, or are there just a lot of other reasons?
It can be. What we know, so PCOS, so polycystic ovary syndrome, is a condition that's actually been known for a very long time. There's evidence that, as far back as 5th century BC, doctors talking about this, they had different names for it. But anyway, so PCOS has been known for a long time. It's not a new condition. It's one of the most, at least, common endocrine, so hormonal conditions in women. It may affect anywhere from 10 to 30% or more of women worldwide, so it's huge. Not all PCOS women are obese, and not all obese women have PCOS. So it is a factor. A large part of women with PCOS are overweight. Most of it is central obesity, just like all the other metabolic syndrome conditions. So it's not necessarily. So weight is not the only issue. There's many other issues.
So what are the main causes then? For those listening or watching that don't know a lot about PCOS, kind of what is it and what causes it? And then we'll get into the diet aspect.
Wow, so I'm writing quite a bit about that. Dr. Fung has asked me to really look at the research out there. And so even though I'm saying to you PCOS is not a new condition and it's been known for quite a while, it's still very unknown. A lot of things are very unknown. In the 80s, the studies actually showed the insulin resistance connection and how, so PCOS is not just a metabolic syndrome, but it's also a reproductive issue, and the insulin resistance part of it. So then we start to see insulin as not just a metabolic hormone, but as a reproductive hormone. So this is one of the causes. seems to be a genetic component, a very strong genetic component. So women with PCOS seem to pass this down to their daughters, and it seems to affect sons hormonally, which is interesting. So there is a genetic component to it, very strong. So sisters seem to have, a very high incidence of sisters with PCOS. So there is a genetic component, but there is definitely an environmental component as well. Diet is a big thing. Insulin resistance is a big, big thing that we want to focus on, because it's something we can work on. We can help, just like, if I didn't make that connection, I wonder how many years it would have taken me to get pregnant, because I wasn't overweight, right? So if we focus on the weight issue, we're going to miss it.
So go ahead.
No, go. I'm done.
So how far back, you said back to the 5th century, is there any historical evidence about diet, or is that kind of a recent finding?
So that is such a good question, because the last study that I was just summarizing and kind of writing a piece on was saying that there really we don't really have any studies, maybe some good clinical evidence, but really no real good studies on women, dietary habits, appetites, how that is all affected by PCOS. Clinically, I think there's a lot of very good evidence. And it's important to note that I'm not telling you something that many doctors don't already know. There are a lot of fertility doctors working on this, or at least have an idea that diet is important. I think the problem is most women are just told to lose weight. A lot of women are put on metformin when they have PCOS and they're trying to get pregnant. So the insulin resistance is known. I think what's missing is a diet, kind of a specific diet for insulin resistance, which is the low-carb, high-fat diet, also known as a strict ketogenic diet. I think that's what's missing. There's very, very few people, very few doctors doing that.
So if somebody's experiencing some of these symptoms now, I take it it's a kind of a systematic approach. So it's diet, exercise, weight loss, or is like what percentage of importance is the diet to all of this? Is that essential, fundamental that the diet has to be changed?
I think the right kind of diet, right? If you're doing a low calorie, we know the calorie in, calorie out approach. You just talked about exercise. If we go back to that and we put women through the ringer, eat less, move more, I don't know that that's going to help people. I have to say to you that the reason why I'm an all or nothing kind of person, when I went through my own issue, like I said to you, I weighed maybe 115 pounds, maybe, I don't even know. I was little, and I gained a bit, but I knew there was an issue. Why did I gain this weight? Why did I have this, belly growing sort of thing, when I was always so underweight, so that to me, I knew enough to know, okay, I have to do something and it has to be drastic, because weight is not the big thing. So that's why I said I went on the strictest of the diets that I had. I used to call these detoxes. I used to put people through these because I didn't feel like people could do them all the time. So I would throw in these little detoxes in between what I call the base diet. The base diet was like a whole grain, healthier sort of approach. I don't think that did much for people. But I would throw in all of these little detoxes, as I call them, and they were these strict low-carb diets. So I just decided to put myself through that for a month. And I think that's what did it. So it's not the eat less, move more theory that's going to help people. It's a diet that's going to help people lower their insulin levels.
Right. So if somebody wants to lose weight and they cut their calories dramatically and they're eating a bunch of high carbs, but they cut their calories dramatically, that is probably not going to help, correct?
It might help some people because, some people may drop their insulin in comparison to what it was before by starving themselves, but will it work all the time? Is that the best approach? I don't think that it is. I think that the best approach is not to starve yourself, but it is to help lower your insulin, improve your insulin status.
So you mentioned going all in on your diet. What did that look like?
It looked like kind of the diet that I eat now. I was always okay with fats. That's the one thing about naturopathic medicine. I wasn't afraid of fat. So I was always okay with eggs and butter and all of that stuff. in that my base diet, as I said to you, so the diet that I would allow people to sort of eat in between, I would allow for the good carbs. So like the brown rice, back then, that's what we thought was healthy. And so the in-between diets was just vegetables, protein, and fat. It was the strict low-carb ketogenic diet. And so that's what I ate then. And so I thought I only had to do it to get pregnant, and I did. It worked, right? So then when I did get pregnant, just like most of my patients, I completely got off the diet. I don't know that I even thought it was healthy to eat that way when you're pregnant, right? Because that's what we're told. So I didn't eat that way when I was pregnant. I had a whole bunch of issues. Because if you have insulin resistance, like myself, and you had PCOS, and you get pregnant, your incidence of gestational diabetes is huge. Okay, so if you do manage to get pregnant with PCOS and you don't deal with the insulin resistance, you are up for a lot of challenges. Gestational diabetes, preeclampsia. I had severe preeclampsia, which is a very dangerous condition in pregnancy. I had very high, blood pressure, which carried on after the pregnancy as well. So this is the kind of stuff that women are looking at if they don't resolve the issue before they get pregnant.
Right.
And if they don't continue on a plan when they are pregnant.
So do you follow the ketogenic diet now?
I do, 100%. So once I had my second child, like I said, by then I was overweight, and then I had everything. I had everything you can think of. I was pre-diabetic. I had medicated, right? Hypertension, which is high blood pressure. My lipid levels were not good. I had the postpartum depression. I had a lot of issues that I truly believe were, at least in part, there might have been a genetic component, like I said, but at least in part, due to the fact that I had a very poor diet. I thought I had a super healthy diet because I ate whole grains. I ate many times a day. In fact, I never had a full meal in my life. Until I was in my 30s, I never had a full meal. I would eat small snacks a million times a day. I had a lot of rebound hypoglycemia, so I would have these highs and lows. I was shaky all the time. I needed to eat all the time. And because I was thin, it made total sense that I would eat all the time. So in fact, I caused this without realizing it because I was having this really healthy, all I ever ate was fruit, like I said, whole grains. So a lot of brown rice. I was mostly vegan, vegetarian, and lots of chocolate, right? Of course, because one thing pulls a lot of chocolate. Yeah. I had a major chocolate addiction. And because I was constantly eating, my insulin was so high that I would crave, and I was in storage mode all the time, right? Because insulin is a storage hormone. So the more you eat, the more often you eat, and the more carbs you eat, regardless of the kind of carbs, the higher your insulin. So I constantly needed to eat. And the higher your insulin, the more likely you are to have these rebound hypoglycemic. And I had it all the time. In fact, I was known for that. It was like, oh, Nadia has to eat every couple of hours. And it was like, of course she does. She's so thin. Look at her, she has to eat kind of thing. But I was creating this state, which became very, very obvious. And I think a lot of people go through that.
So you were eating all the time. I have friends that are thin that eat a lot like that too. How does your day look now when you eat? Is it, do you incorporate intermittent fasting into it? Because I know Dr. Fung's big. I think you probably got it intermittent fast when you work with him, right?
Yes and no. We work independently. He's got his own patients. I got my own patients. I work a lot more with Megan, more directly with Megan. Not physically, but we are a lot. We talk a lot and we coordinate a lot. But yes, at this point, before I started working with Megan and Dr. Fung, and I think Megan was a huge influence in my life, both professionally and personally, but I didn't fast. I did intermittent fast, but very short fast. I did the 16-hour fast. So when I say I didn't fast, I did fast, but I didn't do extended fasts. I did 2 meals a day keto. And by 2 meals a day, I mean 2 full meals a day. I eat a lot more now. I don't look at calories. The only reason why I do look at calories is because I'm very big on diet and I make up recipes for my patients. And so if I'm going to put stuff onto an app and figure out recipes and macro count, I end up figuring out how many calories I eat a day. I know for a fact I eat more calories today than I used to before, which doesn't bother me at all. keep in mind that at some point I did gain weight. Like I said, after my second pregnancy, I was overweight. So then at that point I did need to lose weight. But that's not how my issue started. It wasn't weight first. It was everything first and the weight came after. And a lot of our patients are like this. They first start with diabetes and a lot of these other issues, and the weight comes after. In some patients, it's the other way around. It's the weight first, and then once they're morbidly obese, they start to develop all of these things. Metabolic syndrome does express itself differently in people, depending on their genetic makeup, probably, and the type of foods they eat as well. So right now, my diet looks like on an eating day, it's still 2 large meals, ketogenic. The key thing is I do not snack, and I do not eat higher than a certain amount of carbs. If I do, the beast comes out. I am grazing and craving and miserable like everybody else. You know, when you first introduce this type of approach to people, they're like, well, no, I can't go more than 2 hours or 3 hours without eating. I'm like, well, obviously not, because of the kind of foods that you're eating, right, and where your insulin is. Once your insulin comes down, like mine has come down, I'm not hungry, right? I eat a large meal, very high in fat, moderate amounts of protein, and very low carb. My health is improved tremendously. I've lost all the weight. My skin is cleared up. I mean, I am the PCOS woman, right? So of course I had the acne all over, the hirsutism, which is the hair growth in women. This is a huge thing. You know, both my mother and I have it. I guess you always will have it. This is a major thing. You know, when I write about PCOS, I always say a couple of things. One, it's not fun. You've got really bad periods, very painful or absent periods, lots of acne. You do everything to get rid of that acne, and it's there. The hair growth, the amount of time and effort that women put into getting rid of that, male pattern sort of hair growth. And then very serious, we're talking about diabetes, heart disease. This is a very not fun and very serious. And then the third thing is it's very common. It's one of the most common conditions in women. And we don't really hear that much about it, do we? And it's so common.
Right. So you just described all these symptoms of PCOS. So if somebody has not been to a doctor and hasn't had it checked out, but are those are the main symptoms? If somebody's saying, I just don't feel good, I'm gaining a little weight, my acne, I got these issues, they need to go see a physician.
Right. So then they would, PCOS is what's called a diagnosis of exclusion. So then they exclude other things. But the hallmark sort of, in order to diagnose PCOS, they do an ultrasound to look at the actual ovaries to see if there is the polycystic formation. They look at the androgens, so the male hormones, they tend to be higher. And ovulation is a big thing. Are women ovulating or not? So these are the 3 main things that they look at. Obviously, all the other symptoms are there, but in order to diagnose, they look at these 3 things. And then I think at this point, it's 2 out of those 3 that will 2. So if they do have abnormal male hormones, the PCOS, and then the lack of ovulation, 2 of the 3 will diagnose PCOS. So some women will have all of those, and some women will have some of those.
So if you go to just a primary care physician, and I know this is just a guess, I'm asking you to guess, but how many are knowledgeable about diet as part of treatment, or are they going to prescribe metformin or just, so if somebody goes to a doctor and diet doesn't come up, nutrition doesn't come up, what should they do?
That's a tough question. So I don't think that diet is a primary line of treatment for PCOS. I do think, like I said, that the women that are overweight are told to lose weight. Any woman that's overweight that goes to the doctor is told to lose weight, regardless if they have PCOS or not. Does the doctor come out and say, you have PCOS, which is an insulin-resistant condition, so you need to do a low-carb, high-fat diet? Definitely not. Very unlikely. If you're very lucky, that's going to happen. But it's very, very unlikely that's going to happen. Yes, women with PCOS are put on either a pill, right? The pill that seems to help with some symptoms. Some are put on metformin, and then there's a whole bunch of other treatments, depending on, I wrote a post about this. Like maybe women are put on 10 different things for the 10 different symptoms that they have, when really maybe they just need to look at the one root cause of it. and help that through diet. I'm not against medication. I took metformin and that helped me get pregnant the second time around. I'm very thankful for it. But metformin is a medication that helps to improve insulin sensitivity, so to reduce insulin resistance. So that was key for me because I needed my ovaries to work.
Right. So you have a blog that you talk a lot about this. So patients who go to the doctor and because I spend a lot of time in healthcare, and they treat the symptoms, and
right.
So I always advise people they have to take it upon themselves to go out and find. Yeah. So you have. Go ahead.
I keep interrupting you, Dan. Sorry.
Oh no, go ahead.
No, I think that when it comes to metabolic syndrome, I think that people do need to sort of take it upon themselves to research, because there's a lot of great doctors out there like Dr. Jason Fung that are spending all of his free time writing about this. And he's telling people, he's a nephrologist, so he sees kidney patients. And he's saying, at some point in his career, he said, this is not possible. I can't just keep putting all these people on dialysis and injecting them with insulin. I'm not making anybody better. This is metabolic syndrome. What's the root cause of metabolic syndrome? How can we help these people? And that's exactly it. There's no point in putting a Band-Aid on each boo-boo when you could just figure out why they're getting so many boo-boos, right?
Right. So in our last few minutes, so if somebody is watching this right now or listening to this and they have symptoms, what are the steps? Do you recommend always going to a doctor first, or changing your diet, so just what would you recommend to somebody listening?
I'm a big believer in complementary medicine. For me, what complementary medicine means, it doesn't mean you need to go to a naturopath, because I am the weirdest naturopath you will have ever met, because I don't do anything that other naturopaths do. I've only ever worked with medical doctors. So the reason why I met Dr. Fung is because I used to work with medical doctors in South Africa and in Mozambique. That's all I've ever done. They diagnose, I give them the diet, they give medication, and we just keep going back and forth. It worked beautifully in Mozambique, and thanks to Dr. Fung and Megan, it's working beautiful here too, because I get to do my part and they do their part. So I'm not trying to substitute treatments. I'm just trying to do some complementary treatment with it. Right. And to me, that means diet and sometimes medication.
Yeah. So that's a great point you brought up. So just talk about what the two different types of medicine would do. So if you see an allopathic, and you see a naturopathic, how are they different?
So like I said, I don't know if it's unfortunately or fortunately, whatever it is, because of my situation going to Mozambique, I never got to develop my other naturopathic skills. I did do a lot of acupuncture because I loved it. I don't anymore because I don't have time, unfortunately. My time is all taken up with the IDM program and the diet. But I used to do a bit of that. I never really did much of the other stuff. And so I can't speak for naturopaths, because naturopaths do some serious, amazing stuff. There's IV treatments, there's all kinds of homeopathic treatments, and I don't do any of that. I never have. I don't know how to. I've only ever done diet. So my approach when I talk about complementary medicine is diet, focus on diet. It's always been diet. It just was always, I was trying to get to where I am today, right? I had learned this on my own. I didn't have anyone to tell me what to do. And so I started with, as I said, the base diet, very whole grain with a lot of detoxes in there that would do these strict low carb diets. So that's what I did, how my journey was. And at this point, I recommend a ketogenic diet. It's a strict low carb, high fat diet. Like we said, my website clearly has, it's both my website and the IDM program website has a lot of open information, a lot of stuff that we'd like people to learn, whether or not they join our program. We still, like I said, Dr. Fung spends all of his free time doing this, right? Like videos, blogs, he does lectures all over the world. He writes the books. The information is there. People can read up on it.
Do you recommend staying ketogenic or cycling in and out of it?
That's a good question. My life takes care of that, to be totally honest. I think that it's very hard for people. There are lots of people, and I know lots of people that are very strict keto. They never cycle out of it, and they do great. So I don't believe that it's necessary, but I do think that life does it for you. I was very strict keto for probably 2 years until I joined these guys. And then you asked me that and I didn't answer the rest of that question. Because of Megan and Dr. Fung, I do so much fasting, which in my human brain ends up looking like I allow myself a few things here and there because I know I'm going to fast. Like today I'm fasting. So now it's just become a habit that on the weekends I probably have a higher carb meal and then I fast. I do extended fasts. So a 72-hour fast quite often. I'm a big fan of them. I think that with the information that's out there about growth hormone production and autophagy and all these other things, I'm turning 40 in a couple of days, and this is all really good information for me. So I do them. I love them. I love how I feel. And then I go back to my ketogenic life.
On your 3-day fast, is it water only, or do you use anything else?
Water and salt.
Yeah. I've done a couple 5-day water only fasts, and it's not as hard as everybody thinks. It actually gets kind of easy on day 3, 4, 5. For
me, a fast has to be, and by water only, there are electrolytes, but no bone broth, no fats, no nothing. That derails me. So, and also it kind of slows things down for me. If I'm just doing water and salt, because I'm fat adapted, I go into, even if I kick myself out of ketosis with a weekend meal, I go into ketosis very quickly. So
right.
The energy comes in, and all of that. If I have like some cream in my coffee or whatever it is, I feel hungrier. I feel like eating after that. If I don't eat, I don't feel hungry, and I get a lot more energy. So I do water only. A lot of our patients don't. They do throw in what we call sort of the training wheels or, the crutches, whatever you need. Eventually you probably won't need it. Once you do find out how you feel on a water only fast. It also has a lot to do with the diet that you do in between though. I think that the fact that I am fat adapted, that I do follow a ketogenic diet, it's very easy for me to jump into a fast.
Yeah.
My body just goes, oh, you're not going to feed me? Okay. Let me get some of this and give you some energy, and then I feel fine.
Right. I stay pretty ketogenic most of the time, but I have went into fasts, being higher carb, going into the fast. So much harder. Much harder. Oh, it's almost impossible. But if you're ketogenic or low carb for a couple weeks and you go into a fast, it's so much easier. I'm kind of doing this. I eat like 1 meal a day now. I do eat drink bulletproof coffee. So I guess that's technically a meal, but
right.
It's
the
just
1 meal
so
a
easy.
day, we talk a lot about that. Megan talks a lot about this, and Dr. Fung too. The 1 meal a day, I'm assuming, Dan, that you're sort of in a very good maintenance sort of state in your life. So it's very different than many of our patients. A lot of people come to us and join our program because they're doing this 1 meal a day, which is very easy to do, but they're not seeing great results because they have a long journey ahead of them, right? So if you're trying to speed up your metabolism, if you're trying to lose weight, if you're trying to lower your blood sugars, or even trying to get pregnant, the 1 meal a day approach might not be the best way for them.
Yeah. And
not yet.
And I mean, personally, I just kind of eat whenever it's just
random.
Yeah. I just randomly, when I'm like, oh, I should probably eat, but, well, so on the fasting, one last question about that. Who should not fast? Who should not do intermittent fasting? Is there?
Yeah. A lot of people shouldn't fast. Children shouldn't fast. I have kids. I have 2 kids, as you know. I talked about that a lot. They're little. They're 7 and 4. They know we fast, and they in their little brain, they understand it, but it's not an option. Actually, we let them eat when they're hungry. Well, sort of. The mother in me doesn't really let them do that, but definitely children. And we get a lot of these questions, right? We get a lot of parents say, oh, my 14-year-old, my 17-year-old. And it's like, if they're still growing, you shouldn't be trying to get them to fast. Some people naturally fast in the morning, that there's natural kids that just do not want to eat in the morning. And I know that myself, I still have that urge to force them to eat. But so kids shouldn't be forced to fast at all. If you're pregnant, which is a big thing for us in our program because we're trying to get people pregnant. So fasting is a great way to get people pregnant. But then if they're pregnant, so I do a lot of the cycling, like the first 2 weeks of their cycle, I get them to fast. And then after the 2 weeks, no more fasting. So pregnant women shouldn't fast for sure. Anybody who's got, we're very cautious about people with eating disorders, except for binge eating, because most everybody that we see binge eats because they eat so much carbs. Like I used to binge eat. But if you have other conditions, psychological conditions, then fasting is probably not for you. But that's up for debate, of course, that people say different things. And people that are malnourished. I mean, if you're undernourished, fasting is probably not a good idea, but we don't ever get to see those people.
Right. Well, that's awesome. Well, in our last moments, tell us about your program, because you offer online, right? As well as, kind of walk us through that and how somebody can get.
So we have a new website, actually. It's idmprogram.com. IDM stands for Intensive Management, so idmprogram.com. And although Megan and I and Dr. Fung still do see people in office here in Toronto, we're actually not taking in any new in-office people. We're just kind of keeping the ones we have, because our online program has been going for a few years, but it's grown. We have a lot of people from all over the world. I believe you're in the States, Dan? I don't even know.
Yeah, I'm in St. Louis.
Okay, so we're in Toronto. So we have big part of our patients are American, a few Canadians, but not as many as the American patients. We have a lot of Australian patients, all over the world, really. So that's the bonus of having this online group program. So that means that not only are people they don't have to sit there and just listen to me talk. They get to hear people as well, which is great. That's the best part of our program. So individualized within that group context. We speak to each person individually, but everybody else gets to listen to their journey, their questions. We come up, so I would come up with a plan with each person based on whatever they've done and whatever they're comfortable with. And then everybody gets to listen, and then they get to listen to everybody else. When they join the program, Megan does all the training, so they get to do about 5 hours worth of training with Megan. So she gives them the general guidelines, the basic guidelines, both the diet and the intermittent fasting. And then they join the groups. I'm one of the consultants. So if they join my group, then I'm the person that would be in charge of coming up with a specific plan and troubleshooting with them. So we speak weekly usually, and answering their questions and tweaking as we need to, making sure they're doing things safely. We do recommend always medical supervision, especially for longer fasts. So very, very important to note that I'm there for dietary guidance, but not medical guidance. So it's important that even if their doctors don't agree with what we're doing, that they still know what they're doing so that they can properly supervise them.
And you mentioned Megan a couple times.
Yeah, Megan's our program director.
Okay, yeah, just so everybody watching. And you have a website yourself where you write blogs and some other things, right?
And I write a lot about diet, so the ketogenic diet. So my website is drnadia.com. So doctor is in doctornadia.com. I do upload recipes weekly, so there's always new recipes, usually things that I try out myself. I do talk about fasting, but it's, I just have a link that takes you to Dr. Fung's blog because he's the fasting person. And I stopped blogging for a long time because I was, so busy with the IDM program. But now I'm blogging again about PCOS because I think that's a big thing. There's just not enough out there on PCOS and insulin resistance and metabolic syndrome and diet.
Well, that's awesome. So any final comments, any tips, tricks you want to share with people watching or listening?
Oh, I think we've covered everything that I can think of.
No donuts. Quit eating donuts, right?
I will tell you something that I think is important, and this comes up all the time. I get people always saying to me, whether when they're starting this or they're trying to do sort of an in-between diet, they don't want to be so strict or whatever. And they say, when you're craving sugar, what can you eat? People always want to know this. If you're craving, what can I eat? Should I eat some berries? Should I eat some dark chocolate? I have to tell you that my foolproof thing, if I'm craving sugar, is to eat fat. This is the best advice I can give you coming from a carb addict myself. If I am craving sugar, that means I've eaten something that was higher in sugar, for sure. Otherwise, I wouldn't be craving it. So if I go and eat some berries, or people say, well, what if I just eat half an apple or something just to tie me over? You're just feeding the beast. In an hour, you're going to be craving something else. By the end of the day, you're going to be attacking the cookie jar. So if you're craving sugar, the best foolproof way is to sit down, have a nice full fat meal. That will stop. That's my advice to you.
Yeah, awesome tip. Awesome tip. All right, Dr. Nadia, thank you so much for being on the show today. I know, I think you're going to have a lot of people contact you because this is a big issue with a lot of people. So thank you, and thank you for all that you're doing in your clinic.
Oh, thank you. Thanks for having us. It was a pleasure.
Okay, thank you.
All right, bye, Dad.
Bye.